Hi everyone, welcome back to my channel. Today we're going to be talking about a condition that impacts millions of women globally and also takes on average 4.5 years, yes that's long, to be diagnosed, and that condition is Polycystic Ovarian Syndrome or PCOS. If you're interested in hearing what PCOS is and how it's diagnosed, please stick around. Alternatively, if you want to know about the treatment options, that's going to be in part 2, where we talk about both the conventional as well as the more integrative treatment options for polycystic ovarian syndrome, and that will be in the next video. At the end of this one, it will be linked. All right, let's dive into the diagnosis of PCOS. As you may have heard when I was describing polycystic ovarian syndrome, syndromes should have stood out to you, and a syndrome is not only a condition that has a collection of symptoms, meaning that there is multiple phenotypes, which means that women with polycystic ovarian syndrome are likely to present differently. While one woman may have facial hair growth or hirsutism, another woman might be dealing with acne, while yet another one is dealing with infertility symptoms. This is really important as it's one of the main reasons why this condition takes so long to get diagnosed. So we're going to talk about the exclusion criteria, conditions that need to be ruled out prior to the diagnosis, as well as the clinical diagnostic criteria called the Rotterdam criteria, which we're going to start talking about right now. So the Rotterdam criteria is widely accepted diagnostic criteria, of which you need to have 2 of the 3 following things. The first one is irregular or absent menstrual cycles. The second is signs of androgen excess. Androgens are typically thought of as the male sex hormone, and symptoms related to signs of androgen excess include acne, hirsutism, which is again that facial or other unwanted hair growth, such as like around the breasts, or you may have male pattern baldness. This is typically seen like at the midline of the scalp as well as like at the front of the head. And the third criteria is polycysts on the ovaries. This is typically found on a transvaginal ultrasound. So you need to have 2 of these criteria, as well as having ruled out other conditions before a diagnosis can be made. It's important to know that with PCOS being a syndrome, as we said before, there are different phenotypes. So PCOS patients are commonly thought to present as being more overweight, maybe having acne on the face, or dealing with fertility. This is not true, as again we mentioned that they may have a propensity to potentially have those symptoms, but some women might be more athletically built due to the high testosterone or how they live more actively. And other women might be really struggling with the fertility part, while others still are dealing with the hirsutism and acne symptoms. PCOS is generally thought to be a multifactorial condition. There is a genetic component where in twin studies, they found that twins are much more likely to both have PCOS if one of them has the condition. This is also true of cousins. If you see cousins or having any relative really with the condition, you might be more likely yourself to have that condition. Additionally, PCOS has an environmental role where exposure to excess androgens can increase the ability to have a diagnosis of PCOS, as well as there is supposedly a linkage with insulin resistance and metabolic health conditions, because when a person has insulin resistance, this can impact our hormonal system. Resistance meaning that your body is making higher levels of insulin, and what this does to the body is that it can impact the conversion of estrogen into androgens, whereby your testosterone would be increasing. And that can then look like the excess androgen symptoms. So we talked about the Rotterdam criteria. Some of the conditions that need to be excluded are typically done via a blood test. So these include things like hypo or hyperthyroidism, congenital adrenal hyperplasia, and hyperprolactinemia, as well as others. These conditions, again, are typically eliminated via a lab test that your doctor will run first. Then they'll usually also recommend you do a transvaginal ultrasound to see if you have ovarian cysts. Receiving a diagnosis of PCOS can be incredibly overwhelming, with many women reporting that they experience a sense of loss of self or a confusion about what's happening with their body, especially when talking about fertility. One study found that women with PCOS were 4 times more likely to have reported difficulties becoming pregnant. And so, when you need help, please seek it out. If you're newly diagnosed with PCOS, remember that this is only one part of your story, and that with the right information, support, and care, you can manage the symptoms and lead a fulfilling life. If you're interested in sticking around, the second video, as I mentioned, is going to be about treatment options, both conventionally as well as just more naturopathic integrative health options. So please stay tuned if you're interested in that information. Thank you guys again so much for watching. Please spread this information to women in your life who might be struggling, or just women in general, so that they're more aware of this condition and can reach out to a family practitioner or otherwise when needed. If you found that watching this video, maybe you're concerned about your own personal health, please seek out those individuals, your family doctors or your gynecologist, and get the information and support that you need. Thank you guys so much for watching. Again, drop your comments below. I would love to know what you learned, or if you've gone through this kind of experience dealing with a diagnosis, what you've been told from your healthcare providers, etc. We would love to know and just learn from you guys. All right, take care. Bye.